gonna work? Can you see this?
Yep. All good. Yeah.
Oh, wonderful. Okay. So hello everybody. I'm Tina and I am a bioengineering PhD student at the University of Southampton. My project involves combining computational modeling methods with public involvement to investigate hand osteoarthritis. So almost a full year ago now, not 6 months, well, I thought it was 6 months, it's actually 12 months. I came to visit to talk about the early stages of my PhD. And during that coffee morning, we had some really interesting conversations about the direction of my project from both a public involvement and a computational modeling perspective. During this session, I outlined a few next steps. So today I'm here to talk about some of the progress that we've made in the past year. So I just thought I'd give a quick summary of what this presentation will be about. So I'll give a project background as a quick refresher or introduction to those who are joining us today. And then I'll give an update on the PPI and modeling outcomes before ending with a little description of a secondary public engagement project that I've been fortunate to work with as a result of the early PPI work we did last year. So for background, what is osteoarthritis? Well, osteoarthritis is a degenerative joint disease that can affect any joints in our body, including our hands. It is categorized, but not limited to, the breakdown of articular cartilage, the change of shape of the surrounding bone, as well as the thickening of the joint capsule. So you can see this in the image on the slide, which compares a non-osteoarthritic hand to an osteoarthritic hand. In the hands, OA symptoms can vary, but they most commonly include joint pain, joint stiffness, difficulty in moving fingers, a weakened grip, but also swelling and tenderness in the knuckles and around the wrist. And I think in the image, you can kind of see on the right-hand side, some of that change of shape around the knuckles. So in health science and engineering, the two fields that I'm in, it's important to develop a better understanding of the biomechanical parameters or factors so that we can improve clinical assessment as well as the design of treatment for musculoskeletal disorders such as osteoarthritis. So a tool we can use is computational modeling, and that's the use of computers to simulate and study complex systems like those responsible for human movement. It's a powerful tool in biomechanical research, and it helps us test things without actually interfering with the patient's treatment. And other examples of use is it can be used to test for new joint implants before they're tried in people, or to plan for surgery. So later on in the presentation, I'll talk about one modeling type we've been using, and that's statistical shape modeling. So let's be specific about the hand, because that's my research area. Accurate modeling of the human hand is actually quite a challenge, and that's mostly because of how complex the hand is on structure basis, but also the fact that it can produce a really complex movement. So there are 27 small bones in the hand, and they're surrounded by various soft tissue, which together facilitate 27 different directions of movement. So you can see how it could be difficult to model that on a computer. So whilst state-of-the-art models of the hand do exist, there are limitations, and some of these limitations can come from what data you're actually putting into the computer model, but also the fact that the final model can be a simplified representation of a real-world system. So the question is, as engineers, are we building a meaningful model? So we love focusing on numbers and the quantities of stuff when we're designing devices or tools that will be used to treat or monitor musculoskeletal conditions. However, as we know, hand osteoarthritis is a complex research area where the biomechanical factors can impact the social factors, such as an individual's lifestyle. Those same factors can impact the biomechanical analysis being done by the engineers. Therefore, there is almost a need or a scope for taking a broader approach so that us as engineers can involve people with the expertise that we may live without. So this is probably one of the most important slides, and it's talking about how we can take more public involvement approaches to biomedical engineering, because as a discipline, biomedical engineering does not only concern engineering principles, but it covers a whole range of different stuff like biology, medicine, and pharmacy. And so the collaboration between bioengineers and non-engineers is common, and it is encouraged as well. However, it's a discipline that is technology driven. So research does tend to be done on people and for them rather than with them or like by them. And we've seen that placing patients and members of the public at the center of healthcare research can lead to unique perspectives, which can result into greater quality and clinical relevance and impact of research. So overall, this slide is saying that PPI can highlight ideas that researchers may not have considered without lived experience, and thus can ensure that what is being designed by the bioengineers is fit for purpose and addresses the end user's needs. If I'm going too fast, also just let me know. Yeah, so this next slide is sort of talking about my PhD's project methods. Whilst hand-joint disease has a major impact on people's confidence and their independence, as well as their quality of life, the actual biomechanical analysis of the hand joints is at an early level of understanding compared to the lower limb joints, such as the hip and the knee. We hear a lot about hip and knee osteoarthritis, but not so much about hand osteoarthritis. So the overall aim of my PhD is to investigate how key clinical, biomechanical, and social factors and characteristics of hand joint disease can be investigated by incorporating the public's voice and thus generating computational models of the human hand. So that was sort of a quick project update, project background. So now I'll give the update. During the design process of a computational human hand, we need to consider, as I just said, the biomechanical, clinical, and social factors. So public involvement has been at the core of the development of this project, and we hope to involve even more lived experience and clinical perspectives throughout the project. In the later slides, I'll also describe some of the statistical shape modeling we've done, but also a public engagement project that we've been able to facilitate as a result. So since starting this project, PPI has become a major area of work, probably much bigger than we all envisioned, and much more than a traditional engineering project has seen. Due to this, and with the help of the PPI team here, we've separated the PPI efforts into a much clearer plan with clearer objectives. So I've kind of separated them into three main areas or stages, with the first one being the consultation stage. And this has involved meetings with members of the public who are currently living with either clinically confirmed or suspected osteoarthritis in their hands. And these meetings have and will in the future outline major biomechanical, clinical, and social factors associated with hand osteoarthritis from a lived experience perspective. We also hope that this block of work can help us talk about the contributors' experience with public involvement, and this will be evaluated using standard logs and questionnaires. So the second bubble of work is the collaboration stage, and this includes the formation of a contributor advisory group to co-produce an educational and interactive online resource, which will detail the key factors in the consultation stage. So this is more the collaboration, co-production stage of the PPI work. And then we sort of wrap it up towards the end, hopefully, is the dissemination stage. And this will concern the publication of the online resource and will include the evaluation from feedback we get from the online users. So in terms of the progress we've made, the consultation stage has been really, really fun to get involved with. Here is an example of just some of the outcomes from our early PPI work. So we had a few sessions with members of the public of the local OA community, and we came up with lots of different ideas surrounded by lots of different considerations. But here's an example of a Jamboard that we created in an hour. So I'm really proud because we put loads of things on a board and we just talked about it. And this one concerns the impact of hand osteoarthritis. So we just talked about the different activities of daily living that are affected, the types of movement they have to do to compensate for maybe a loss of hand function, their definition of joint instability, stuff like this. And it was just a good way for us as a team to address the context of the project and also identify and prioritize what potentially computational models can be looking for. So after a few sessions that we had, we found that a lot of our discussions fell into common themes. So we have 9 key themes which are presented on the screen. And from this, we've been able to identify and prioritize research areas, but also apply for funding for a sister public engagement project, which I've mentioned already, but talk about more later on. And hopefully we aim to share this work with more of the general public and academic staff, but more about this to come. So if we move on to the computational modeling stuff, the stuff the engineers love, we have to put some data into this. So the data that we're using was collected in a previous study by Metcalf and al. And it includes image and motion data from 10 participants who are free from any hand or wrist conditions or injuries. All of this data was collected from the right hand of each participant, and the right hand was scanned into 3 different positions. So full extension, which is just when the hand is out like this, I'll put my camera, then mid flexion, and then near flexion when it's clenched like this. So this data has recently been used in the development of statistical shape models. So what is statistical shape modeling? I'm hoping I can explain this without going too much into it. But what it is that studying the difference between people's joints is a challenge for any researcher when they're designing tools or devices for treatment or prognosis. So statistical shape modeling is a computational modeling technique which can represent those variations in shape or mechanical properties in a population. So it can identify this anatomical variation in a subgroup as well with a common background. So if it can be used to investigate variations in osteoporotic or osteoarthritic populations, as well as subjects with specific ethnicity or gender. So it's one way for us to take a big block of data and try and compare it to each other from like a more group perspective, a more population-based analysis. Yeah, so my work is currently focusing on building a statistical shape model of the finger joints, and we've successfully done one for the proximal interphalangeal joint, which is the second joint in your finger. And this, basically what it does, it creates an average geometry of the collection of data. So what we have is those 10 participants, you run it through a statistical shape modeling code, and it will produce averages of that, but also it will tell you what the main variation is within that population. So mathematically, it transforms an original data set, so these 10 right-hand image datas, and then takes it, transforms it into a new set of variables, which are unrelated, but they're ordered so that they contain the first few modes of variation. And what a mode is, it's a type of variation observed in a population. For example, size, curvature, joint space, any differences they see within the data. So what we found is that the first mode of variation in 10 participants free from any hand injury or condition, we found that the sizes of the bones was the greatest variation within the population. The second greatest variation was the bone's positioning. So what is the proximal phalanx, which is the third bone, and then the middle phalanx. They found in the population, the position of those change between individuals. And then we also have six other modes of variation. But as you keep going along the modes of variation, the amount of variation decreases. So the first mode is the biggest variation, and then the 9th mode is the smallest. So hopefully using this statistical shape model, we can evaluate shape variation in the finger joints, but also quantify things such as the joint space, but maybe also take a more population-based approach to modeling the movement of the finger joints. Because currently, when it comes to movement models, there isn't much variation. They don't really take into consideration what that's like across a population. They usually take sort of one data set and see what happens there. So, okay, so this is the last project update, but it's also talking about PPI. So as a response to some of the greater PPI work we did, we created a steering group, which aims to gather those interested in or closely linked to the PhD project to help identify, prioritize, and oversee the decisions being made. Here's a list of different people we have on the team currently. And these are really useful sessions because every 3 months is a chance for us to meet, for me to provide a project update, to get everybody in the room to discuss their views and observations about the project, which is really good. So we welcome guests and new members. So if this sounds like if you sound like this is interesting to you, feel free to let me know, or one of the team, and I'm sure we can get you on the steering group one day. So the last bit is talking about the public engagement project I've been on about all the way through. During the PPI sessions we had early on last year, our public contributors were really vocal about their experience, but also about the representation of their experience. So not only were we talking about public information, but also the information presented in academic research, and therefore the need for some of these considerations to be put into research representative of the lived experience. So because of this and the time restraints of the PhD, we decided at a steering group meeting to apply for funding for another project, of which our public contributors would be part of the core team to raise awareness of hand osteoarthritis. So this project is called the How Would You Handle This Project? Kudos to my supervisor for naming it. It's a collaborative project which is funded by the Public Engagement with Research Unit, and it will see public contributors, engineers, health scientists, clinicians develop this educational and interactive digital resource to raise awareness of what it's like to live with hand osteoarthritis. It's also a project that aims to communicate to scientists and specifically engineers, as that's sort of my background, the importance of working with members of the public to incorporate the lived experience insights in the design of healthcare technologies. As well as this, we also hope to host a lot of different events to share the work we've been doing with members of the public, but also to talk to young engineers and young scientists about the importance of incorporating these lived experience perspectives in the design and research process. So this project started in October last year, and we've hosted a few events talking to undergraduate engineering students, and they've been really fun and really eye-opening for the students, because it's sort of the first time they have been exposed to the idea of PPI from a traditional engineering teaching background. That's probably one of the first time they've talked about implementing it into the design process. So we hope to have a lot more of these talks to sort of get the idea out there. So to summarize, the degeneration of hand and wrist presents a major socioeconomic problem and is a barrier to healthy aging. So one of the tools we can use to investigate hand osteoarthritis is computational modeling. Overall, though, building a complete and accurate model of the hand remains a challenge because the hand is so complex. But as a complex research area, it means it's important to consider the broader perspective and address the needs and the challenges of the end user when we design tools and devices, so that it considers what the end user needs. So overall, the PhD project aims to investigate these factors by combining computational modeling practices with public involvement and engagement. Thank you for listening.